Hello and welcome. My name is Carol Trower. I'm the Chief Officer for the Berkshire Local Pharmaceutical Committee, and I'm going to take you through this presentation, Making Every Contact Count, an introduction to community pharmacy. This is a basic introduction to what community pharmacists and their teams do, designed for people working in local government. Local government has now taken on responsibility for public health, so if you're a councillor newly appointed to your Health and Wellbeing Board, or a member of the public health team thinking about how community pharmacies can help you achieve your goals for the public in your area, or you have a more general interest in how local councils can improve health through community pharmacy, then I hope you find this a useful start. So let's start with some basic facts and figures. Community pharmacies are local businesses that supply medicines and provide NHS and private services to improve health and well-being in a local community. Community pharmacies are independent contractors to the NHS. They are run by large high street chains like Boots, or supermarkets including Tesco and Asda, or more local chains like Lloyds Pharmacy and the Cooperative, or by independent community pharmacists who run the business they work in every day. Every day, around 1.6 million people in England visit a pharmacy. Of those 1.6 million visits, 1.2 million are for a specific health reason: to pick up a prescription, to ask for advice from the team of trained staff, to buy an over-the-counter medicine for themselves or a member of their family. In the presentation, I will cover how we see community pharmacy can provide benefits to local communities through providing high-quality and accessible health services. So why choose community pharmacy as part of your provider network? First and foremost, pharmacy is a readily available network located in the heart of every community. This means not just on the high street or in the local town centre, but in local shopping parades and in the heart of local neighbourhoods, including in the most deprived communities, where the community pharmacy is often left when all else, including the local post office, has gone. Community pharmacies are open longer, later, 7 days a week, 52 weeks a year. 99% of the population can get to a pharmacy within 20 minutes by car and 96% by walking or using public transport. Located as they are, community pharmacies represent an investment in the future of local communities and can act as a focal point for the local population. As we shall see later, this access and convenience is starting to be exploited by some local councils as a hub for the provision of continuing access to services that might otherwise be withdrawn. Here are some more facts. 84% of adults are visiting a pharmacy at least once a year, 78% of them for health-related reasons. With the ageing population, growing numbers of people are suffering from one or more long-term conditions. On average, adults in England visit a pharmacy 14 times a year, with most of them using the same pharmacy every time. That's a lot of medicines. The volume grows every year by 2 or 3%. Governments of all persuasions are interested in maximising the value of the community pharmacy network. Over the last few years, we have seen the emphasis shift from the sole provision of medicines to providing a wider range of health and social care services, building on the convenience of the locations and those extended opening times, and making greater use of the expertise of pharmacists and their teams of trained staff. So what is it that community pharmacy is trying to do? In essence, community pharmacy is aiming to provide a joined-up care and support that is both personalised and coordinated. Our focus in primary care is clearly on ensuring that patients, first and foremost, get the medicines they need efficiently, with information and support to enable them to get the maximum benefit from the treatment prescribed. In recent years, community pharmacists have been able to provide this support through the provision of NHS medicines review services, where pharmacists will sit down with a patient and talk through their medicines with the aim of improving understanding of the medicine and how it works to improve symptoms or treat the underlying condition. More recently, with the NHS New Medicine Service, pharmacists will follow up on new prescriptions to find out how people are getting on with their new treatment. Building on that, the network of community pharmacies provides an opportunity for councils to think about population-based public health, to use the access and convenience for preventative and early intervention strategies, and we're increasingly seeing that happen. Overall, what we are trying to achieve is improved outcomes and experiences for individuals and communities, genuinely to make every contact count. Let's meet the community pharmacy team. Who typically might you find working in a pharmacy? Let's start with the pharmacist. Pharmacists are university graduates trained in medicines, specific aspects of medicines, their design, their formulation, their use. Pharmacists are registered health professionals and are regulated by the General Pharmaceutical Council, as the General Medical Council does for doctors. Community pharmacies will have a range of team members. Healthcare assistants, who are often the very first point of contact in the pharmacy for members of the public. They are the people standing behind the counter, or the person who greets you when you first walk in. Healthcare assistants are themselves trained to a national standard. Pharmacies often rely on a range of working arrangements. The extended hours many pharmacies now operate will mean that you will often find a mix of full and part-time workers in the team. Full-time or part-time, healthcare assistants are trained to the same national standard. An important member of the team, usually fully involved with the supply of medicines back in the dispensary, is the pharmacy technician. They are also registered professionals regulated by the General Pharmaceutical Council. Pharmacy technicians are trained to a minimum of NVQ Level 3, largely in the technical aspects of medicines and their supply. Pharmacists and technicians, when working in the dispensary, may be supported by dispensing assistants. These staff members, who are also trained to at least NVQ Level 2, are there to support the processes in the dispensary. And last, but by no means least, community pharmacies increasingly employ drivers to deliver medicines and other products to those unable to get out and about. Given their role, drivers can be an important link to vulnerable members of the community. So community pharmacy, in one respect, is also a big employer, employing well in excess of 100,000 people in England. More importantly than that, the community pharmacy team is usually a local one. The healthcare assistants and technicians particularly will be both living and working in their community, serving friends, family and neighbours, a factor in itself can be important in powering up a locally delivered service. Let's now look at the sort of people a community pharmacy typically serves each month. So when you break down the 1.6 million daily visits, this is what you find for a typical pharmacy in a typical month. And all of those people will have their own specific needs, and pharmacists will be thinking about what they can do to support them individually. So why are pharmacies important to councils? First of all, that 1.6 million visitors per day is a tremendous opportunity for you to get across key messages to your local population. Often the most difficult bit in getting any message across to people is to create the opportunity. Community pharmacy is a destination for many people as they go about their daily lives, and therefore can be the point where that opportunity exists. And increasingly, we see our job as making the most of that opportunity, to ensure that every contact counts. How do those national numbers break down locally in terms of daily numbers? Your typical local community pharmacy completing an average of 5,500 or 6,000 prescriptions a month is likely to see around 100 patients or carers a day, thanks to those prescriptions, and a similar number coming in for health advice or to buy a medicine. All in all, around 200 people every day. A high proportion of your local population will be visiting a pharmacy this month, and the likelihood is that a large percentage of those members of the public will be in your target group for health and other initiatives. With that kind of access, if you want real value for money, your local pharmacy teams could be what you're looking for. A network of centres of health excellence with private consultation facilities within walking distance of your target market. Let's look at some examples. Local authorities are now responsible for commissioning a range of public health services. Community pharmacy is able to deliver a number of these. For some, community pharmacy should even be considered the natural home for them. These include NHS health checks, This cardiovascular risk assessment is being carried out in community pharmacies up and down the country. For example, in Birmingham, cardiovascular screening services for men over the age of 40 has been taken up by over 10,000 men. Raising awareness of an individual's alcohol consumption is something else that community pharmacy has been taking on. The community pharmacy, as a neighbourhood destination, might not be the place you might expect such issues to be raised, and they can be more powerful as a result. For example, in the North West, 100 community pharmacies have provided an identification and brief advice service for up to 3 years now. In London last Christmas and New Year, community pharmacies distributed over 25,000 alcohol risk assessment scratch cards, highlighting safe alcohol drinking messages. Increasingly, community pharmacies are thinking about other vulnerable patient groups. There is currently a lot of discussion within pharmacy about how we might become more aware of the issues faced by people with dementia or those caring for people with dementia, and there are other, more specific services dealing with particular patient groups. Community pharmacy is now being used to provide closer-to-home solutions for services that might traditionally have required a time-consuming and expensive hospital visit. Anticoagulation monitoring is now routinely undertaken by community pharmacies in the North East and on the South Coast. Cholesterol testing may be offered as a service in its own right or as an integral part of an NHS health check service. Similarly, diabetes risk assessments may be provided as a service by a pharmacy in its own right or linked to the health check service. For example, in Norwich, the health check service includes body mass index, blood pressure and blood glucose tests. These are just examples. With control of public health commissioning now sitting with local government, you will be able to commission pharmacies in your area to provide a range of services, including weight management, sexual health and stop smoking, to meet the needs of your local community. An analysis of current evidence supporting the role of community pharmacy in delivering a number of health interventions can be found on the Solutions for Public Health website in a document entitled Community Pharmacy and Public Health. In some areas of the country, this basket of service is coming together in a delivery model known as Healthy Living Pharmacy, or HLP. The Healthy Living Pharmacy initiative is designed to harness the significant role that community pharmacies can play in reducing inequalities. The HLP programme is designed around the delivery of consistent and high-quality health and well-being services that promote health through proactive interventions. The HLP programme started as a government-funded initiative some years ago in Portsmouth. The programme develops those elements in a pharmacy, including leadership, skills and the pharmacy environment that together are important in enabling the delivery of high-quality care. Crucial to the concept is the role of the health champion, a role often undertaken by a healthcare assistant or pharmacy technician. Health champions have a national qualification designed by the Royal Society of Public Health, which provides the skills to support behavioural change in individuals who want to quit smoking, lose weight, or generally lead healthier lives. Not all pharmacies are HLP accredited, and pharmacies don't have to be accredited to provide services, though the public health community is increasingly recognising the value of consistency that can be achieved using a programme approach that focuses on building the enablers to better delivery. Around 40 areas of the country are actively developing the concept, and over 700 pharmacies have been accredited in England. I now want to focus a little more on the evidence for those public health services. The number of people who quit smoking through a pharmacy is increasing every year. 5 years ago, around 50,000 people were helped to quit by their local pharmacy. In 2011, that number was over 70,000, and the number continues to increase. Pharmacy has a consistently successful 4-week quit rate of around 45%. Community pharmacy provides an opportunity to widen the client base and to reach individuals who might otherwise be unable to access the service. All in all, pharmacy is responsible for around 20% of all smoking quits in the UK, a figure that is also increasing as a proportion of the total year on year. As well as general advice about increasing physical activity, pharmacies can be involved in a more distinctive way. In Norfolk, for example, community pharmacies have been working with national and local sports organisations to develop a series of community activities to encourage physical activity in the over 50s. Over 1,000 events have been held, with over 2,000 people referred in by their local community pharmacist. An example of an approach to weight management, the My Choice Weight programme, run by the Heart of Birmingham Teaching Primary Care Trust and Community Pharmacy, has achieved some success in achieving weight loss across a patient cohort. I've already mentioned the Alcohol Scratch Card programme. The Rethink Your Drink scratch card on the left here was the one used in the successful London programme of last winter. In this simple intervention, the answers to 3 simple questions translate into an alcohol risk score, which can be the prompt for further discussion with the health champion or pharmacist. Harm reduction around drug and substance misuse is an area that pharmacy has been involved in for many years. Here's the scale of the problem. In 2008-9, 10% of adults in England had used an illegal drug in the previous year. You will know that the economic and social costs of drugs are huge. In health terms, injecting drug users are at risk of all sorts of infections, including HIV. Acute bacterial infections due to poor injecting hygiene, non-sterile equipment or contaminated drugs causes health problems which alone cost the NHS almost £50 million a year. The number of community pharmacies contracted to provide services to substance misusers has doubled in the last 5 or 6 years. The service has also developed over time. Some now provide HIV testing. Most provide sterile injection and other equipment. In fact, community pharmacies provide 80% of the needle exchange facilities in England, and research continues to show that these services are both cost-effective and cost-saving overall. Approximately 80% of all community pharmacies have private consultation areas where supervised administration, needle and syringe exchange and other services can take place. The dispensing of methadone as a heroin substitute continues as a mainstay of the treatment part of the service. Hepatitis B and C testing is increasingly seen as an integral part of the service, with the accessibility of pharmacy providing a winner when it comes to delivering 3 treatments over 21 days, which can be done while clients are accessing their daily methadone. As we have seen, community pharmacies already provide great access for people requiring health advice, but they can also be used to support effective signposting to local social care services. A pharmacist or trained team member can actively engage with the individual, which is a step on from the passive awareness campaigns such as leafleting in libraries or via local media. Here's 1 or 2 local examples from Hackney. Air Quality in Hackney provides air text alerts which are particularly useful for those suffering from a respiratory condition or heart problems, and particularly the elderly and children. Shine is a one-stop referral system established to tackle fuel poverty as a means of reducing seasonal deaths and hospital admissions. Pharmacists help by referral through an online form for those in at-risk groups. In our last example, Bromley Winter Health, pharmacists actively refer to Age UK and the local borough home improvement team. In February and March this year, community pharmacists were responsible for more than half of the referrals to Age UK Bromley and Greenwich under this programme. Finally, if you would like further information on how pharmacy can support your local community, please contact your local pharmaceutical committee. There are over 70 of these across England. You will find your local contact through the website highlighted on the screen, www.lpc-online.org.uk. The contributors to the development of this information piece are listed on the very final slide after this one, but this concludes the presentation. If you have any specific comments on the content or would like further information on any of the specific examples used, then please contact us through the Pharmacy Voice email address here. Thank you very much for watching and listening.